You're listening to Menopause Natural Solutions, episode 37, Menopause and Urinary Dysfunction. Welcome to Menopause Natural Solutions, your podcast for all things perimenopause and menopause related. Stay tuned as naturopath Jennifer Harrington explains how to use natural therapies to transform your health and happiness. Hello and welcome back. I know last week I was really excited and mentioning my book, and I promised to give you an update this week. And the update is that it's heading off to the printers. So I don't have it in my hot little hand today, but hopefully next week I will have the physical version in my hot little hand and be ready to tell you all about the pre-sales that we're going to be doing on Amazon. I'm sorry that's not going to be happening today, but at least you know we're working on it and it should be all good to go next week. So today we're going to be talking about a new topic, one that we haven't discussed before, and that is on urinary tract dysfunction. Unfortunately, incontinence and urinary frequency is a concern for perimenopausal, menopausal and postmenopausal women. The official name is urogenital atrophy. While this term includes the vagina as well as the urinary tract, we are going to focus on the urinary system today. Atrophy is such a horrible word, but it simply means to deteriorate or waste away. And common symptoms include the need to urinate more frequently, incontinence, which is the inability to control urination, or being prone to urinary tract infections. The main cause of urogenital atrophy is the lack of estrogen. As estrogen levels reduce, the bladder starts to weaken, as does the urethra, which is the tube that carries urine out of the body, reducing your ability to control urinary function. Another cause of urinary dysfunction is pelvic prolapse. Here the organs of the pelvis area drop into the vagina, and this could be due to the trauma of a vaginal childbirth or the weakening of pelvic muscles due to the reduction of estrogen. Pelvic organ prolapse weakens the pelvic floor muscles, and this results in urge incontinence, which creates frequent, sudden, strong urges to urinate with the possibility of not making it to the bathroom in time, or it could result in painful urination. One of my top referrals is to pelvic physiotherapists. I'm not sure if you're aware, but there are specifically trained physiotherapists purely focus on the health of the women's pelvic region. So guys, if this is a concern, that is the number one thing I recommend, is to book yourself an appointment. Here they're going to investigate you for a prolapse, and they're going to design an exercise program to help you strengthen the pelvic floor muscles. They can also see if you're a suitable candidate for other treatment options. And there are a couple of options that they have, and one is biofeedback therapy. This technology helps retrain your pelvic floor muscles and increases the amount of urine your bladder can hold, plus helps control the timing of urination. Sounds pretty good, doesn't it? Another possibility is electrical stimulation of the bladder muscles. Another possibility is a vaginal pessary ring. This device is inserted into the vagina to help it hold up a prolapsed bladder. There's also a urethral insert, and this is like a small tampon. It's a disposable device that's inserted into the urethra before a specific activity, such as exercise. And many people have exercise incontinence, so this is something they can use just as a temporary solution. Surgery, and there are various surgical techniques, and this is something that you would need to discuss with the pelvic physiotherapist. But it can be useful in some cases. So guys, don't forget acupuncture. Acupuncture may also be beneficial. Let's move on and chat about urinary tract infections. As many women will experience urinary tract infections during their lifetime, but for about 1 in 5 of you, this painful infection can become recurrent and a vicious cycle of reinfection may occur. And infections are more common with times of hormonal change, such as pregnancy and menopause, but it can also occur with diabetes, with multiple sclerosis, if you're prone to kidney stones, or if you have a catheter. Unfortunately, it's also triggered by sexual activity for some women. Signs and symptoms of urinary tract infections include pain. Hello, pain. Yes, stinging or a burning sensation. I've heard it explained like peeing out razor blades. So yes, you'll definitely know if you have a urinary tract infection. It also includes a feeling of urgency and frequency. And quite often there's not much urine coming out. You've run to the toilet for a drop. Some women will experience fever and fatigue and other signs of generalized infection. Your urine may look different. It may be cloudy or dirty or dark and strange smelling. But if you have blood in it, you've got to head straight to your doctor. You may also experience pain in the lower abdomen or in the lower back. And some women, I don't know how, but for some women, they have minimal symptoms at all and simply discover an infection with routine testing. Prevention is definitely better than a cure, so I have a few ideas for you to help prevent an infection in the first place. Now guys, some of this is pretty basic stuff, but if you were never told, you would never know. So when you go to the toilet, you always need to wipe from the front to the back. And hopefully your parents taught you this as a child, but just in case, after every trip to the toilet, put your hand around the back and make sure you're wiping from the front to the back, as this prevents bacteria from getting into your urethra. If you are having sex, you might want to consider showering and washing your genitals afterwards. Urinating after sex is an absolute essential. And when you are having sex, make sure you're really, really well lubricated, because lack of lubrication can increase your risk of UTIs. Are you on any hormonal products? Certainly hormonal contraceptive and hormone replacement therapy can make you more prone to infections, so can a poorly fitted diaphragm. With underwear, I want you wearing cotton, breathable, preferably organic cotton underwear. Or another consideration is to wear nothing at all, especially when you're at home. It's really good to let the air circulate down there. If you have a private yard or a balcony, or if you like nudist beaches, fresh air and sunshine are even better. I had an old university lecturer that swore by sunshine therapy as a treatment for not only urinary tract infections, but also for candida. So I'll leave that with you to consider whether you want to try that one out or not. We want to avoid wearing stockings or tights and living in active wear, because these really block airflow. We want to avoid wearing tight clothes such as jeans. We want to make sure that your bladder, when emptied, is emptied completely. And this is a catch-22, because I want you to be well hydrated, which is probably the last thing you want to do when you've got urinary frequency. I want you to consider having showers instead of baths. And look at your soap or your body wash. It's really a good idea to use a natural product like a goat's milk soap without any fragrances or chemicals. Actually, I want you to check all your female hygiene products if you're still using them. Cotton is one of the most heavily sprayed crops, and I don't want you putting pesticides directly on this region. And if you're using incontinence products, this is also where I want you to consider getting organic incontinence pads, or even buying the machine washable pads, so that we're not getting those nasty chemicals anywhere near our delicate genitals. Now, when we're looking at diet, processed carbohydrates, our breads, our rice, our pastas, cereals, cakes, these kind of things, convert to sugar in the body. And sugar is the primary fuel source for infections and bugs. So you want to avoid any of these processed carbohydrates like the plague. I want you to focus on protein. So we're talking things like meat, eggs, tofu, nuts, seeds, fish, chicken, as this builds your immune cells and helps to fight infection. So really focus on making sure you've got a protein on your plate. I also need you to look at good fats. So things like avocados, eggs, olives, coconut, seafood, because these reduce inflammation and pain. Cranberry juice you may have heard of, but I want you looking for a sugar-free variety, and these are generally not found in the supermarket. Cranberry helps to prevent bacteria from sticking to the wall of the bladder, and bacteria need somewhere to attach to be able to divide and replicate. Therefore, the juice flushes it out and the infection is over. Cranberry contains a couple of active ingredients that help here: proanthocyanidins and D-mannose. D-mannose is also found in blueberries, apples, peaches, and oranges. And other foods that contain proanthocyanidins include blueberries, bilberries, strawberries, and grapes. So, guys, berries. You can see the common theme in there. Probiotic-containing foods, such as fermented foods, can help prevent infection and increase the good bacteria available. Although I would probably use a probiotic supplement, and there are some urinary specific ones available on the market. Making sure you're eating other immune boosting foods such as garlic, and I want you to increase your alkaline containing foods. So lots of fruits and salads and vegetables in general, as the more acidic your body is, the more prone to infection it is. When I am considering supplementation for a urinary tract infection, I've already mentioned my high-dose immune-enhancing probiotics, and in particular your urinary-specific probiotics. Did you know you can also get cranberry juice in tablets? Or you can even go straight to a D-mannose product, which is the active ingredient in the cranberry. Herbal medicine combinations can also be quite useful. And I look for urinary tonics, urinary antiseptics, anti-inflammatories, and diuretics. And some examples that can be used here include alfalfa, bearberry, celery seeds, dandelion and chamomile, they're really good ones, chickweed, corn silk, echinacea, goldenrod, horse chestnut, marshmallow. The list goes on. I forgot yarrow and thyme, they're also good ones. I'll also consider magnesium. If you're experiencing a lot of cramping pain with urination, and general immune enhancers and antioxidants like vitamin C and zinc. So guys, I hope you found that useful. We had a general chat about urinary health. I really want you to consider going and seeing a pelvic physiotherapist. They're going to help assess whether there's any prolapse or whether there's any other strategies that can help reduce your symptoms. I want you to start looking at your diet. Lots of proteins and fats. When it comes to carbohydrates, we want you having lots of fruits and salads and vegetables, but I also want you to avoid the processed carbohydrates like your bread, your rice, your pasta, bread, that kind of thing. Plenty of water and maybe some cranberry juice and the supplements as mentioned before. Well, that's it for me today, guys. I just wanted to check that you guys are aware that I do actually see one-on-one patients. So if you've been listening to the podcast and you want to get to know me a little bit better, please jump on a discovery call and we can see whether we're suitable for working together or if I actually think there's anything I can do to help you. I'll leave a link to book a discovery call in today's show notes if that's something that you would like to consider. And I can't wait to chat to you all next week. I've actually decided I'm going to do a little bit of a book reading next week, so you can get a little bit of a taster for my new book, From Invisible to Invincible, The Natural Menopause Revolution. I hope you love it as much as I do. I'm so excited about this. This has been many years in the making, and it really has been a passion project that I can't wait to share with the world. I hope you are having a wonderful day, and I look forward to touching base again with you next week. Bye for now. Thank you for listening to Menopause Natural Solutions. This podcast contains general information about menopause. It is provided as a guide and is not intended to replace medical advice. Opinions of guests are their own, and this podcast does not endorse or accept responsibilities for statements made by guests.